Hey, everybody, welcome back to the Energy MD podcast, where we help people resolve their chronic fatigue, ME/CFS, long COVID, and MCAS so they can live the life of their dreams. So, really excited today because we're going to be talking to an MCAS expert, among other things. So, my friend Meg Mill. So, let's learn a little bit about Meg. So Meg has a doctorate in pharmacy and is a certified functional practitioner with over 2 decades of clinical experience. She is also a best-selling author, podcast host, summit host, and sought-after corporate wellness speaker. Her virtual functional practice has transformed the lives of hundreds of clients worldwide by connecting the dots between their diverse, unexplained, and often overlooked health struggles, such as migraines, gut issues, chronic fatigue, skin reactions, anxiety, or allergies. She uses her EAT method, EAT method, to uncover and resolve the underlying connections, whether it's histamine intolerance, hormone imbalances, gut dysfunction, or MCAS, mast cell activation syndrome. She empowers clients to take back control of their health so they can regain the energy, mental clarity, and confidence needed to fully show up for their lives again. She's been seen on lots of TV, magazines, blogs, and podcasts. Meg, thanks so much for joining me today.
Thank you so much for having me.
So today we're going to be talking about histamine. And first, before we get started, I know you've got an event coming up, so I want to make sure we touch on that first, because that's all about MCAS, correct?
Yes, yep. So we have a summit coming up June 18th through the 24th, where you are one of our 50 experts, and we have almost 50 hours of education on MCAS and histamine intolerance. It's called Reversing Mast Cell Activation Syndrome and Histamine Intolerance, and it's a free educational event. We're really trying to get the word out because, as our listeners know that this is often misunderstood. This is not something that many of your general practitioners are going to know. And a lot of the symptoms are overlapping with other symptoms. So we're trying to create education, clarity, and an avenue for people to get help and support. And it's all a free event. So I think you're going to put the link in the show notes, right, for people to register.
Yep, we will definitely do that. And so let's dive into histamine versus MCAS. So I guess let's get some definitions here first so that people can kind of understand what MCAS is and then how it relates to histamine.
Okay. So let's start actually with histamine because it's
Okay.
it's a molecule within your body. So histamine is a biogenic amine. And so when your immune system detects an allergy or an invader, histamine's released primarily from your mast cells, which we'll talk about that, and your basophils as part of your immune response. And so this molecule is going to increase the permeability of your blood vessels. It's going to allow your immune cells to reach the affected area more quickly. And there are a lot of great purposes with histamine. It just gets a bad rap. I feel like it's kind of like cortisol now, where cortisol has functions in your body, but it wreaks havoc. And same with histamine. It has great functions, purposes, but when we get it in excess, that's when we start to see all these symptoms. So it helps with immune defense to protect us against pathogens. It regulates gastric acid secretion to increase the breakdown of foods in your digestive system. It can affect neurotransmitter activities because there's histamine receptors all over the body. It's part of your allergic response, and it's actually also part of your inflammatory response. So it recruits immune cells to the site of infection or injury through increased vascular permeability and blood flow. So it's really important in that function, except the problem is when we have too much histamine, we're getting this constant inflammation, we're getting these constant problems, and we're getting symptoms. So, when we're looking at histamine intolerance and mast cell activation, there is a lot of overlap in symptoms, but they're two different things. So it's like this little like kind of triangle of okay, they can affect one another, but they're also different. Let's move on to mast cell activation then. So your mast cells are releasing the histamine, and when we're having mast cell activation syndrome, we're having an excess degranulation of the mast cells. So your immune system has your innate immune system and your adaptive immune system. And your innate immune system has the mast cells as part of that first response. Like think of them as those soldiers that are ready to go. Anything that comes in, we're just going to fire and we're going to protect you. But the problem is when they start protecting you against things that aren't dangerous. And you're getting protected against food that you like, or sunlight, or air, or EMFs, or different things that really you shouldn't be reacting to. But these mast cells become overreactive and they start degranulating and they start releasing histamine. Now, some people with mast cell activation syndrome won't have histamine symptoms. That's pretty rare. I would say, from my personal experience and research, most people that have mast cell activation will have some symptoms of histamine, because when those mast cells degranulate, they do release histamine, but some people don't. So that's one thing to note, that if you think, well, I don't have mast cell activation syndrome because I don't have the high histamine symptoms, that's not necessarily 100% the case. Now, you also can have histamine intolerance without having mast cell activation syndrome. So histamine intolerance really comes about when you get this imbalance of overflow of histamine into the body with the ability to break down histamine. So for this, I really like to use a bucket analogy. Think of your body as a bucket with holes in the bottom. So we're filling the bucket up, it's draining. We're filling the bucket up, it's draining, and it's flowing, and your body's nice and you're fine and you're symptom free. And then something happens, either where the plugs and the drains the bucket gets plugged, or you're pouring too much in the bucket, or both, and you start to spill over. And that's when you start to have all of these symptoms. So we need to be able to not have so much histamine coming into the body, and that could be from mast cell activation syndrome, that could be foods, that could be chemical sensitivities, things that are causing allergic reactions, causing this histamine. And then we also need to be able to metabolize the histamine, and we do that through diamine oxidase and methylation. And so we need to make sure those pathways are also open, so we have this nice flow. I know that was a lot of information, but I'm just trying to give both points.
No, that's really helpful. So then, in summary, histamine is produced by the mast cells, or mast cells produce histamine. I think histamine is produced in other things in the body, but mast cells will produce histamine, and that can cause a lot of symptoms that people are having.
Correct. Yes. And this is one of the things that I do like to point out here too, is that these symptoms can actually happen all over your body, because we have 4 different types of histamine receptors. So I think when people think of histamine, you're thinking of allergies, congestion, sneezing, asthma, and those things are symptoms. But we also see headaches and migraines, fatigue, heart palpitations, vertigo, anxiety, depression, difficulty concentrating. We can see PMS and irregular periods. We see flushing, joint pain, insomnia. We can see high or low blood pressure, and we can see a lot of skin reactions. So as you can see, these are whole body issues, a lot of where there's so much more research on digestive symptoms and how that's actually a histamine or a mast cell issue, often in IBS. And so I think it's really fascinating that you can, when you're working with histamine and when you're calming those mast cells down, we start to see so many different symptoms clear up. So it's one of those, okay, this can often be that common thread of I have all of these symptoms, which, as we can see, a lot of these overlap with other conditions. So it's really trying to figure out, okay, where is this coming from? But when we start to work on this through a histamine lens, I often see, okay, now my digestive symptoms are better, and my migraines are gone, and I'm less anxious, and I sleep better, and all these things start to happen because it is really a whole body issue.
Yeah, and I think it's important for people to understand that histamine is actually our friend. You
Yes.
talked about it being that soldier on the front line. Like, it's here to help us, but there's something that's triggering it that is causing it to kind of get out of control, right? So maybe we can talk a little bit about that. And you mentioned it a little bit, but maybe we can go a little bit deeper. What are those things that are triggering histamine to get out of control?
Yeah, so for me, in my practice, the thing that I see affecting it the most is gut health. So when we talked about how, we have mast cell activation syndrome, and that can definitely be a cause. So, but when we're looking at just histamine intolerance in general, we need to be able to break down histamine in the body. And so there's just so much more research. Actually, what is fascinating is that there are actually certain bacteria that are histamine producing and mast cell activating. And so we're starting to learn more even about the species of our microbes that are even causing these things. And I have some interesting stories. One that I really like to share because I think I worked with a man who had total body urticaria, total body itching for 20 years. And he was on several different prescription medications, hydroxyzine, which is, it makes you get exhausted. He was on these medications. He was also getting shots. They were doing everything. No one could ever figure it out. And as soon as the medication would even start to wear off, it would just flare right back up. And he came to me and I said, well, I want to do a stool test on you. And he was like, but I have no gut symptom. Like I have no GI distress, nothing. There's no issues that way. And I was like, well, just trust me, we're going to do this. And he had high levels of some of those histamine producing bacteria that we're talking about, one of which is Morganella. He had very high levels of Morganella. And we did some healing work, some gut healing work. And within about 4 weeks, his itching was gone, no medications. And I think it just like, I like that because it was just such a dramatic thing that he was like, okay, this is not even going to be related. There's no correlation. And it was something more specific. A lot of times there's a lot more dynamics, but it was just something that was so specific to him. And no one had ever looked at that. So we're looking at these particular gut bacteria. Now, we also want to look at diamine oxidase. So that's how we break histamine down in our GI tract. And so diamine oxidase is an enzyme. So a lot of people are familiar with having lactose intolerant. We need to break down lactose in our body, but we also need to break down histamine. So if your diamine oxidase is compromised, you may not be breaking histamine down from your foods. So you may be reacting to foods that are high in histamine because you can't actually break them down. And so we know that we need to work on rebalancing your gut bacteria. Our diamine oxidase is housed in the mucosal layer of our gut lining. So if that mucosal layer is off, if we have some dysbiosis going on, we can actually start to see the diamine oxidase not work as well. We can also start to see intestinal permeability, which can cause more systemic inflammation, and then that can further even compromise diamine oxidase. So we want to look at how is are these microbes creating this response? Are we having trouble breaking it down that can be creating more inflammation, more problems? And then we also, interestingly enough, need certain nutrients to be absorbed to actually facilitate diamine oxidase too. So things like B6, copper, vitamin C. So we need to make sure that what we eat, we're actually digesting and absorbing. So a lot of times that's where I'll start because we need to be able to make sure that we're getting everything in balance. To make sure we can, break this down. And so often that's one of the main factors that we're looking for when we're looking at reasons, but there are other things too.
That's great. So how can you tell the difference between histamine intolerance and MCAS?
Yeah, so I think it's kind of, that's a good question because it's not always easy to unpack and it's hard to get, not that many people have official MCAS diagnosis because of the way, the testing that you have to do so somebody could go to a practitioner that does MCAS testing, test tryptase levels. There's different testing you can do to get an official diagnosis. There is not really as much of an official diagnosis of histamine intolerance. It's really more symptomatic in what you're experiencing. So I tend to see people with MCAS more hypersensitive than people with histamine intolerance. So, often histamine intolerance will be more of a breakdown issue. We can start to see some of the low histamine, we can get into the low histamine diet. We start to see that help. But where MCAS, you're sort of more like reacting to everything and you're reacting to more of the supplements. Not that you can't, if you have histamine issues, that it's gray. It's hard to necessarily, you do some of this, we work on the same thing. So I don't know if there's 100% way to tell, but I think it's more, I would say for me, it's more symptomatic in how we're responding.
Yeah, and I think it's a spectrum.
Hmm.
Interestingly, 10, 20 years ago, when we talked about people were more sensitive, we talked about MCS, or multiple chemical sensitivity, right? And
Yes.
essentially those people have MCAS, or they're kind of on the spectrum. I think that sometimes we get so caught up in the diagnosis, but the reality is that if you are more sensitive, your immune system is hyperreactive, and maybe it's histamine and maybe it's something else, but oftentimes the treatment is going to be the same. Would you agree or
I
disagree?
agree. And that's why I think I don't really worry about differentiating, like, okay, this is this versus that. We're going to work on the same things. So, we're going to work on gut health. We're going to, try investigate with a low histamine diet. We're going to do nervous system regulation, because that's really foundational, particularly for MCAS. I think if you're working with someone on MCAS, you need to be doing that alongside of any therapy that you're doing.
Yeah, I've seen really amazing things with nervous system regulation. I had somebody in my program recently who um, is, I don't know, 70% better just from doing some brain retraining. And she was MCAS and like couldn't eat anything and now can eat like whatever she wants. And I find that, sometimes doing the nervous system retraining is like 10% of the issue with people with MCAS and other and MECFS and the other things we work on, long COVID, et cetera. And sometimes it's like 70%. Like what are you seeing with your population?
Yeah, I agree. It depends on all. I think that's what's so complicated about some of these things is it's so individual, isn't it? It's like where are we putting all of these pieces together for that individual? But I do find it, like I said, necessary, and I would say I see that being a factor for pretty much most people. Like you're saying, it just depends on the spectrum of how much that moves the needle, but it is, even looking back at your trauma and back at all the things that happened in life, there was an analogy that I like that someone used one time, and it's kind of silly, but it is a good way to think about it. If you are smelling a rose and you're touching a hot stove every time, so if someone gives you a rose, you have to smell it, and they're like, okay, touch the stove, and you're like, ow, that's uncomfortable. And then you do it again and you do it again, and then they take the stove away and they're like, now smell the rose. You're just going to feel like you hate that smell. It's uncomfortable. It's not good. It doesn't feel good to you. And so I think that's what's happening is things that are supposed to be safe for you, your body's reacting to. You feel betrayed by your body. You feel like you're out of control of that response. And things that should feel good no longer do. So we do need to rewire that response and say, okay, I am safe in this body. I do have more control. Another thing I think is working with people like that will respect that for you. One of the things that I've had people come to me and say, okay, I've been to, some of the biggest functional medicine clinics in the country. I flew there, I did all this testing, and then they threw like a ton of supplements at me and I reacted to everything and I feel it made me worse. And so they're discouraged because they're making the effort. They're trying to do these things. They're, investing, and now they feel like they can't take anything. So I think really listening to your body and thinking, okay, if you can take one granule of a capsule and you can tolerate that, that's okay. If you can take a fourth, and some of these capsules we can open, like, be patient and listen to your body in your response, and you will get there. I think that's one of the things that I see. And I think that from what I've heard, I've been doing all of these interviews for for MCAS for all these months, but when I was talking, I believe with Neil Nathan, he was saying that there's research that's showing that, because he deals with the sensitivities, that people, even when you are more sensitive, even though you're taking a lower dose, it doesn't take as much to actually get the effect from that low dose. So
Right.
even if you can't take the full capsule that someone else can, you may be getting more response from that fourth of a capsule than that someone else is. And you just have to be respectful of that. And I think that's very interesting too.
Yeah, I absolutely agree. And I And I feel like that's the way that I think about it, but I don't think everybody thinks about it in that way. I mean, in general, when we're looking at people who are more sensitive, where sometimes they need a lower dose of something. Oftentimes we call it sprinkles in our
Yes.
program, right? So they're just taking a little bit of the capsule, or if they're doing a tincture, they're doing it topically. And it's really this combination of like, what is the dose that you're taking and what is the frequency that you can tolerate, and so it's kind of like, maybe you need it 3 times a week because it takes you 2 days to process out of your body. This idea about if we take a certain supplement certain times of day is really based on a 24-hour clock, but that's not necessarily how our body is processing a certain substance or how long that substance is in our body, right? We're making a lot of guesses that, if you take something every morning, like adrenal support every morning, that is actually going to be out of your body by the time you have the next day. And then you take your next dose and that gives you the support that you need for that day, right? So when people are more sensitive, and their detox or drainage pathways aren't working well and things are building up more in their bodies, then potentially they don't need something every day. Is that kind of a accurate representation of what Neil was saying and what you're saying?
Yes, yes, I agree. They exactly. And so they don't in the amount that they take, yes, can be more influential for that smaller amount. And then someone like they might not need as even as much of a dose, like because they're not detoxing it, but also it could be effective for them too, even at that lower dose. And I don't know about you too, but I see also sometimes whenever people get over, it's like inching, and then sometimes you can start, it's like, oh wow, I'm starting to be able to make a bigger leap. And then that's an amazing breakthrough too. I think it is like just seeing some of the transformations to get to that point where you can do more, like your body's finally responding to.
Exactly. Yeah, and I feel like so much of that is kind of like opening up the detox or the drainage pathways. And so I'm kind of curious about how you do that. Can you kind of talk to us a little bit about that? Because I feel like with people who are MCAS, they're reacting because, quote unquote, these pathways are clogged, for a better
Mhm.
term.
Yeah, so I mean, I think we need to start with the base. I know people get like bored with basics, but it's like the basic foundational things first, So it's like, are you drinking enough water? Like, do you actually drink water? And
Hmm.
so that's an important. Do you drink water? Are you getting, as you're drinking water? I love it. Yes. So we need to, and so we need to think about that. We also need to make sure that our bowels are moving because if you only go to the bathroom once a week and you think that's normal and you try to do some detoxing, then you're just going to be reabsorbing things. So we need to make sure, like, are we actually moving the bowels? Then I think doing, you move, like moving into some other, like the saunas. Sometimes people are sensitive to heat. So it's like, and I actually spoke with a infrared sauna company that was actually saying, even this is, I don't know, this is new to me, but they were saying even starting, how it takes about a half hour for your sauna to really warm up to the temperature. If you can't tolerate that, then actually get in as it's warming up, and the infrared is still helping you. So even if you can't tolerate it to start, they were advising kind of to start that way. So I found that just interesting, and have, people can try some of those different modalities. I also like castor oil packs for people with MCAS. So that's another
Hmm.
thing that we will do and start to see if we can get some liver work there before they can tolerate more. How about you?
Yeah, those are all really great tools. Like I think about things that are exogenous or that are outside the body, because 80% of our immune system is in the gut, right? So anything you put in the mouth, the immune system can potentially react to it, right?
Mhm.
So if we can do sauna, which is kind of on the outside, if you can do something topical, like, topical tinctures or a castor oil or sometimes there's coffee enemas, or you're talking about water. I mean, I've worked with people who are actually sensitive to water. That's definitely more challenging. But Yeah, I think those are really great ideas. I think the sauna thing is interesting too because, sometimes people can only tolerate like 5 minutes, and it's hard to know like, is it the heat or is it the frequencies, right? Because, when you look at, a Rife machine or something like that, where, there are certain frequencies that can kill certain infections. And so
Mhm.
sometimes if you're in a far infrared sauna or some kind of infrared sauna that has certain frequencies, sometimes you may be killing infections and having die off, and consequently that's why you feel worse. Or you're trying to detoxify and you're not pooping, or you're not drinking enough water, whatever it is. So it's definitely more complicated, but yeah, those are great ideas.
Yes, yeah, and I think again, everybody's a little bit like we're saying, everyone's a little bit different in what they can in this population, what they can tolerate. So if you just try, try and see what you can, and if you can only get in there 5 minutes, if you can only get in there as it's heating up, if what you can do, just a little bit, just give that hope of like a little bit more every day, a little bit more every day, that eventually you're making progress through
Yeah, and I think
time.
people forget, like we're kind of so focused on the day and we forget about the year, right? So,
Mhm.
we overestimate the amount we can get done in a day and we underestimate the amount we can get done in a year, right? So it's the long game, and that's so hard for humans to think
Yes.
about, okay, if I do something every single day, a year from now, I'm going to look back at this year and I'm going to be amazed at what I've accomplished. Do you find that
Mhm.
to be the case too?
Yeah, actually, it's funny that you said, just about a month ago, I had a call with someone I was working with, and she was down on herself. And she was saying, like, oh, it was just an interesting thing because she had started working with two friends, actually, started working with me at the same time. And they were just coming from, both actually had histamine issues and mast cell issues, but they were coming from different places. And the one friend had lost weight, just as we weren't working on weight, but as we were doing things, she had lost weight. And then I'm on with this other person who was like kind of at the same spot, and she's like really down on herself. And I was like, well, what's wrong? She's like, I'm just not doing as well. And, kind of like feeling like she wasn't making the progress that she wanted to make. And I was like, well, why? And she said, well, I haven't really lost weight. And I was like, okay, so you just told me that you had your energies well, that you don't have any GI distress, that your anxiety's down, that you're not reacting to things. And she was like, yeah. And I was like, well, remember when you came to me and you couldn't get off the couch and you couldn't go out of your house and you were, reacting to everything, whatever. She's like, oh, and she said to me, actually, thank you for sharing that with me
Hmm.
because I didn't like, and I was being hard on myself. And I really, you're right. Like, I look at what I've done, and it was, it was appreciation of, yes, exactly what you're saying. Like, we get in that, okay, now I have to do more, okay, now now this, now, and so it was just taking that time and thinking, like, yes, in a year what can be different and where you've come. And even if you still have places you want to get to, you've come so far.
Yeah, such an important lesson and in perspective. And as humans, we're incredibly adaptable, right? We keep adapting and then we forget from whence we came.
Yes, I know.
Yeah,
We do.
yeah,
I know it's hard, right? And
it
that's where the
is.
nervous system work comes in too, right? Gotta bring it back, calm
Mm.
your body.
Yeah, so I want to come back to that. So do you have a favorite nervous system program? What do you like to do for nervous system retraining?
So I try to do it in three different ways with people that I'm working with. So, we do the bringing our body back into the parasympathetic nervous system with breath work, with regulating your stress response. Um, I have been trained in something called hypno breath work. So it's a combination of hypnosis and breath work at the same time. So when we do that, we actually get into a hypnotic state with our breath, and then there's prompts that we work through to actually try to rewire neural pathways. So it's something that I was drawn to and decided like this was something I wanted to get certified in, to be able to bring that to people that I work with. So that's one of the kind of modalities that we use. And then I do try to do vagal nerve work, try to do some vagus nerve exercises. And then I also do a lot of the thought retraining. And, I think that limbic system work is important. And there are programs out there that you can just totally focus on that limbic system work. But I think that's also an essential piece to really rewire some of those pathways.
Excellent. Yeah, it's such important work. I feel like the emotional work that we do on ourselves is probably the most important work that we do in this life, right? There's
Mhm.
obviously career and this, that, and the other thing, but it's like I've just become more and more interested in personal growth and how to continue to improve myself mentally, emotionally, physically.
Yes, no, I agree. I'm doing it with myself too. There isn't time that goes by that we do not. And I think just even bringing that up. So I have a lot of these issues personally. Like, I think your story comes from personal place. My story comes from a personal place. And over Christmas, I was reacting to something, and my mother said to me, "Oh, you've just always been so sensitive to this world." And I was like, it was a funny thing here. Like, this is what I do. I'm an adult. But I think just bringing that up, like we're also people, we're also doing this work, and it can happen where something gets off too, but you're bringing yourself back into, okay, what do I need to do now? How can I get back to a place where I'm not reacting to everything, where I'm not having these symptoms? And I think that's a journey for all of us.
Yeah, and I think that that also it's really nice when you have a partner who's actually been through it and,
Mhm.
going through it and dealing with a number of these things because you know the tools that have worked for you, you're trying things on your own, I think that's really supportive for folks because it's not just them being told, "Hey, you need to do this thing," and somebody doesn't actually have that experience.
Yes, yeah, absolutely.
Yeah. So let's get practical here with the time that we have left. Um, so let's talk about so somebody who is more sensitive, they've got a bunch of the histamine symptoms, or they think they have MCAS. Where do they start? What should they do in order to start the process of getting better?
Yeah, so one of the things like you can start to do, and I like to use this as a discovery tool, like not a long-term plan. I think people can start a low histamine diet and see if that makes any difference. Now, I think people can also get very hung up on the low histamine diet and think this is their path in life, and I disagree with that. I think it's a good tool to say like, okay, are these foods bothering me? Maybe they can bring down symptoms that they're having, but it's not something like that's your game plan because we need to get to the root cause and what's actually happening in your body. But if you're just listening and you think, okay, these symptoms sound familiar, this sounds like me, you can pull those foods out. So, and I did put a lead, like a guide for you to give to all the listeners. And there is a more complete list of histamine foods. So I have a list in there that people can reference. But in general, we have, high histamine foods, and they can be things like aged cheeses, fermented foods, cured meats, alcohol. We can have histamine liberating foods like strawberries, tomatoes, bananas, foods that limit diamine oxidase. We can have caffeine can actually block diamine oxidase. So we have a lot of different foods that you might think, oh, bananas or strawberries or even bone broth or fermented foods, like those are good foods for you, but they could be causing some of your histamine issues. So it's a tool that you can use to start to see, okay, if I bring these down, does that decrease my symptoms? And see, okay, maybe that's a clue that this is something you need to maybe look into more and get testing and further investigate.
Excellent. And it sounds like we've kind of talked a little bit about like some of the tools that people can use, the castor oil packs and sauna and stuff like that. Do you have favorites that really shift the needle? I mean, even if it's Band-Aid stuff like antihistamines, whether they're prescription, just to kind of
Yeah.
get somebody out of a flare right now if somebody's really struggling.
I mean, I think I actually like a lot of the combination natural antihistamines. So like the quercetin is a great one. A lot of people have a lot of benefits with. So I'll often pair that with some bromelain, some stinging nettles, some different things where we're getting a combination of things. Even vitamin C can be helpful. So, we're trying to bring down the reaction, stabilize the mast cells. We'll try DAO, diamine oxidase supplements, to see if we can take enzymes to help break things down. So we definitely are working on that while we're working on the root cause. So it's kind of like, okay, let's bring down some of your symptoms. Let's work on finding the root cause. Let's put nervous system work in here and start to see if we, start to see that change. I think it's when you're putting kind of all these things together, they start to move the needle.
Excellent. So as we come to the end here, so then where can people find you? We've got megmill.com. Is that the best place to send people?
Yes, yep, that's my website. I have a podcast also called A Little Bit Healthier. So if you want to check that out, we talk about all different things with relation to health. And I'm over on Instagram at Dr. Meg Mill. And come to the summit if this interests you. Would love to see you there.
Absolutely. Yeah, we'll drop the links for that below. And then also the link to the free gift, which is that histamine document, or the essential guide to, what does it say? Essential guide to histamine, free guide.
Yeah, it's Essential Guide to Histamine Intolerance.
Intolerance, yes.
Yes.
Awesome. Wonderful.
Yeah.
Well, Meg, any last things you want to share with our audience before we adjourn?
I think we covered a lot of things, just that there's hope. I always like to say that as the last thing, because I think sometimes when you've been dealing with a chronic illness for a long time, you forget that. And so it feels like, maybe you're saying this work, but will it work for me? And, I think if you can trust yourself, then you can do the things to heal. So stay positive and hopeful.
Absolutely. And when you're working on the root causes, you're going to be successful. It's not a question of if, it's a question of when. And it might just take, a long time, but you're going to get there and you're going to improve along the way. So
Yeah.
Wonderful. Thank you so much for joining me today, Meg. It's great to see you as well. I'm really excited about your event, and we'll drop all those links below.
Thank you so much. Thank you for having me.
So if you have chronic fatigue, long COVID, or mast cell activation syndrome, and you're looking for help, check us out at energymdmethod.com. We have a program for almost every single budget, and we're here to help. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.